First thing I'm going to do is put some alcohol on your toe and clean it off before I do an injection. And then what I'll do is spray your toe with something that's very cold to numb it up, basically, before I do any kind of injection. Let's see. You feel a little sting when I do this. So Nick, you'll feel a little bit of burning.
All right.
You okay?
Yeah, I can't feel anything.
Good. I'm just going to push your toe apart so I can see this down here. Is that burning much down there on the bottom?
A little bit.
So it'll burn. So what I'm doing is numbing the plantar medial cutaneous nerve of the big toe and the dorsal medial cutaneous nerve that goes to the digit first. Usually just below a wheal, which is just getting a little anesthetic underneath the skin and the subcutaneous tissue. Nick, you might feel a little pressure on the top of your toe now.
All right.
Is it burning a little bit?
A little bit, yeah.
Sorry. So what we'll do is, now we're getting the dorsal lateral cutaneous nerve, or branch that goes to the digit. You can probably see a little bit of that anesthetic going in there. Is that burning much?
Yeah, somewhat.
Okay, now I'm going to spray you with the ethyl chloride with the cold stuff again. On the other side. Okay, really cold. I feel a little sting. Did you feel that one much?
Kind of.
I'm just going to kind of separate your toes a little bit so I can inject down along the side. You okay?
Mm-hmm.
And this is going to get the last nerve down on the base of the toe. Is that burning much down there?
No.
Good.
I can just feel some pressure.
You're doing great. Now I'm going to do one more injection, which is kind of what I call my insurance injection, just to make sure the nerves on the plantar aspect on the bottom of your toe are already numb. So you're going to feel that cold stuff one last time.
All right.
You ready?
Mm-hmm.
Really cold. Feel one little sting again. Probably felt that one a little bit. Yeah, it's just going to feel like it maybe burns on the bottom a little. Is that hurting much down there?
Mm-mm.
You don't have to do this. Now it burned a little bit. You don't have to do this injection. Sometimes it's, well, most of the time you can get all of the nerves without doing this last injection, but it's always good to make sure that it's completely numb. Okay, that's the digital block. What I'm going to do is put a little gauze around your toe, just where I gave you the injection.
All right.
This is more to cover up the needle holes, so you don't have to look at it, really. Now, what I'm going to do next is, here, let me put your foot, can I move his foot over here just a little bit? Is that okay? This is just a little iodine or betadine that goes on your toe to kill any bacteria that might sit along the edge of the toe. And you're probably not numb completely yet, but we'll let this sit there for a while. Iodine works a little better if it sits there for a little while. How you doing? You okay?
Yeah.
Good. There we go. Okay, so we're gonna let that anesthetic take effect. This is the sterile gauze that we're going to utilize. This is called an English nail splitter, which is just an instrument to slide underneath the toenail and clip the toenail back. This is just a hemostat. which we'll use to actually pull the toenail out. This is a little tourniquet that we utilize because in the case where we're doing a phenol matrixectomy, we don't want any bleeding to occur because the blood actually deactivates or neutralizes the phenolic acid. So it won't allow it to work unless we have it in a bloodless field or relatively bloodless field. This is a curette that some people utilize to scrape the matrix tissue out after it's been cauterized. This is a packer or a spatula, which is actually utilized to actually free the toenail along all of its edges. The Q-tips are there to apply the phenol to the area, and this is a it's called a 61 beaver blade, which is just a little sharp blade at the end to allow the to free up the last little bit of the toenail down by the matrix tissue, and that's to avoid lifting the rest of the toenail so the chemical can't seep underneath there. This is a tissue nipper that we utilize just to clip off any remaining tissue that might be along the edge of the toenail. But you know, that's only if there's extra tissue there. So what I'm going to do first is I'm going to break this little Q-tip and create a sharp end on the Q-tip. Well, not the Q-tip anymore, but the wood. And I'm just going to touch the end of your toe. Just let me know if you feel anything sharp at all when I do this. Close your eyes. You feel anything sharp? Like a needle? How about over here?
No.
Nothing? How about on the tip out here?
Yeah.
You do feel a little?
Yeah, I can really feel that.
How about over here?
Yeah.
Does it hurt where the ingrown toenail is?
Yeah, I can feel that real well.
Okay, so what we're going to do is put a little bit more of a longer acting anesthetic in there to make sure we get all of those little nerve endings that aren't quite all the way numb yet, because sometimes the digital block doesn't work the very first time. But this is also to allow for more prolonged anesthesia with Marcaine or bupivacaine. Okay, I'm going to still spray, well actually no, I'm not going to spray the cold stuff. You ready? You shouldn't really feel this much at all. If you feel anything sharp, it's a good thing because that's local anesthetic going in there. Is it burning yet? Just let me know if it burns at all. You okay? Now this time I'm going to inject more up by the nail bed, actually. A little different angle. Sometimes those little nerves are way up here. There's this little aberrant nerve branch that actually comes down and innervates the base of the toenail. Do you feel that at all? Feel anything right there?
No.
How about now?
No.
Okay, we're going to try this one over here. Feel something sharp there?
No, I just felt the pressure of it.
Anything sharp there? No. Okay. Is that hurting at all?
No.
Good. All right. Let me just put this away. So what I'm going to do now is put this little tourniquet over your toe, like they probably did before. Is that hurting at all? Good. Now I'm going to start pushing on the edge of your toenail and kind of freeing up the edge of the toenail. If you feel anything sharp or burning the entire time, just let me know right away. How does it feel so far?
It's fine.
I'm going to push quite hard, put a lot of force in there basically to free up the skin around the edge, but gently. Some of this in this case is a little bit of a hematoma. Then what we'll do is put a little pressure. Pinching or sore at all?
I can feel it a little bit.
Still feel it?
But not much.
Like pressure?
Yeah.
Remember, you're going to feel pressure. I can't get rid of all the pressure.
Just making sure.
So that was the spatula we utilized to get underneath there. This is the nail splitter. Is that hurting, Nick? Good. Okay, so we clip that back. Then we're going to use this other little blade, this other little instrument to get down there and clip off a little bit more of the toenail. and free it up just a little bit more. Make sure that's completely free. Then we use the hemostat to go in and grab the entire toenail and kind of in a twisting motion grab it and pull everything all out at the same time. So that's the edge of the toenail and the rest of the toenail that was attached to the matrix tissue down there. There's usually a little bit of dead skin along the edge here. This is a sheath that surrounds the toenail, usually down at the base. Part of that is some matrix tissue that comes out of there. And then what I'm going to do is use a Q-tip to basically clean out any remaining bleeding that's occurring at the base of the toenail. Because, like I said before, the blood tends to deactivate the phenolic acid. And then what we'll first do is I'm just dipping this Q-tip in the phenol over here. And we'll put the phenol, this is now the phenol going in to the base of the toenail, and I'm applying some pressure up against it on all surfaces of the toenail, especially down around the corner of the toe, back down in this area, because there's matrix tissue all around the entire base of the skin and also on the superficial surface of the skin. There's a little extra piece of toenail right there. There we go. And we apply this for approximately 30 seconds. 3 applications for approximately 30 seconds. I'm just counting in my head. Some people actually have a timer, like an egg timer over here, when they're doing it. And I usually move it around so that I can apply it to all the surfaces on a consistent basis. Okay, we're just going to get another one of that. So we're going to do that 3 times. This time I'm going to use a little bigger Q-tip so I can get more of the chemical in a broader area. And again, one of the big keys is to get it over here as far lateral as possible in this case, or as far away from the toenail as possible, because a lot of that toenail tissue grows from the furthest portion towards the eponychium over there. Again, for another 30-second application. Some people will put some antibiotic ointment around the edges if they feel like it leaks out along the edges, just to protect the skin to a certain degree. But I don't usually do that, and I don't usually see any problems with any excessive acid getting out onto the surface of the skin, nor does it cause a problem, even if it does in most cases. So we'll do one more 30-second one more little application here. And then we'll pretty much be done. Okay, let me just pull this off because we don't really need that on there anymore. Now what I usually do is prepare 2 pieces of gauze like this next to each other and fold them together so that there's about 1 inch or 1 1/4 inch of gauze. And I'll put some of this antibiotic ointment on here, which is typically we use Silvadene, and when we're actually creating a burn back at the base of the toenail, and Silvadene being good for burned tissue works pretty well. And then what we'll do is first remove the tourniquet. And there might be a little bit of bleeding, but for the most part, the phenol cauterizes most of the small blood vessels, so you notice it doesn't bleed too much, even though the toe's normal blood supply is already returned. And in order to counteract the effect of the phenol so it doesn't stay on there too long and create too much of a reaction, I'm going to apply alcohol now down along the side of the toenail, or where the toenail was, to deactivate the phenol and also irrigate the wound a little bit. And as you notice, it's still not bleeding, so that's just because the phenol cauterized everything. And then what I'm going to do is just put the bandage on. And again, I have this gauze with a little bit of the Silvadene on there, and I usually put the Silvadene right into the wound like that. Wrap it around the toe once gently, and then there will be quite a bit of oozing once the patient stands up. So we usually put some gauze on there, get it to stay down, and hold it in place with some Coban or some other type of dressing. You could use just tape. Coban works better because you can get a little bit of compression around the wound. And we'll put this around once or twice and tear it off, and then close over the tip because it only sticks to itself. And that's it. And then the patient will keep this bandage on, in this case, until tonight, and then they'll take the bandage off. And once the bandage comes off, the patient will start soaking and the normal post-operative regimen, which is soaking twice a day for about 2 weeks.